I'm going to do glucose monitoring, check off, and I'm also going to administer insulin. So what I have is my patient here that I've got to check their glucose. So what I'm going to do is I'm going to check the physician order. I'm going to identify my patient. I'm going to let the patient know what we're doing. I'm going to wash my hands, and I'm going to put on my gloves. I'm going to ask the patient to wash her hands and dry her hands. Okay, and then I'm going to turn my meter on and put the strip in and have a lancet. I will identify where on the patient that I'm going to draw the blood from for the glucose check, which will be the lateral part of the finger. Explain to the patient what I'm doing, which is wipe it with alcohol, and I will let that dry. And then I would pierce the finger with a lancet, and I would wipe away that first bit of blood with the cotton ball and discard of that, and then I will squeeze the finger and that will come off onto the strip, and then that will give me an immediate result. Once I have that, then I'm going to clean the meter, turn it off, clean it, disinfect it. I will document what we did, take my gloves off and wash my hands, and then I will move on to the insulin. So I'm going to check the physician's orders against the mark for what insulin that I need, and I'll go ahead and come in to the patient's room, identify the patient, explain to them the procedure. I'm going to wash my hands and put on my gloves. So, checking the physician's order, I have ordered insulin. I'll be drawing up 10 units of each. So, I have my insulin. I'm going to always check my date, make sure that this is not expired, and it's not. And I would have 2 vials here for this draw. I have my supplies ready. So, what I'm going to do is, usually you roll the insulin to get it ready. You would pop the vial top off, and then you would clean the alcohol prep pad, both of them. And then your order says to pull up 10 units. So you're going to pull up 10 units of air. And then in our cloudy, we will go ahead and just insert and put the air in, pull the needle out. For my next, we're also pulling up 10 units. So pull up 10 units of air in that one. This is clear. So I'm going to insert the air, but I'm also going to draw up my 10 units. Done that, making sure that we're on the 10. We are. So now we're going back to the cloudy. Draw 10 more, which would bring us to 20 units. And then if I'm outside of the room, I'm going to safely recap the needle, and I would actually label the needle as well, the syringe as what it is, and go into the patient's room, identifying the patient, checking again my order at the bedside for a third check, making sure that I have got the right medication, the right dose, the right patient. And then I would perform hand hygiene. If I'm coming into the room, perform the hand hygiene, put on new gloves if I'm coming in the room. But I'm still in the room with the patient, so I'm going to identify with the patient. Well, actually, I'm going to assess the patient first. I'm going to assess them for signs and symptoms of hypoglycemia or hyperglycemia, check their CBD levels. Going to check the skin integrity of the new site. We're going to check the where they were last injected. And just their readiness to eat. Patient's doing well. I will let the patient know that we can do an insulin injection in their buttocks, in their thigh, their upper back arm, or their abdomen, 2 inches away from the navel. We're going to do this one in their abdomen. So we're going to get our alcohol prep pad. We're going to wipe down the spot that we're going to put the injection. We're going to allow that to dry completely. We're going to take the cap back off, and then once that's completely dry, we will pinch up, and because we can pinch up a pretty good bit, we're going to go in at a 90-degree angle, and then we just put in slowly, going to discard of our needle into the sharps container safely, and then we're going to take a little alcohol prep pad and just apply that over where we gave insulin injection, just gently. Then we're going to remove our gloves and wash our hands, and we're going to document where we gave the insulin injection, how the patient tolerated it, and anything else that